dysfunction. Let's talk about that. The liver is the most important organ in the body. It has more functions than any other organ. In fact, there's over 500 known functions to the liver. Yet most people have symptoms of auto-intoxication. The book, Toxemia Explained, written by John Tilden, MD, explains so clearly that most symptoms that we have is really nothing more than our body's inability to detoxify. We're becoming toxic. When we become toxic, lots of bad things happen. Some of the symptoms associated with poor liver function are a hard pot belly, cravings for fatty, fried, and sour food. Yet when we eat them, they make us feel lousy. Any type of joint degeneration or arthritic pain is a sign of liver dysfunction. The eyes are a wonderful image into the liver. So any yelling of the whites of the eyes, or morning bloodshot eyes, or eyes that are constantly itchy and swollen are all signs of liver dysfunction. Any skin rash, hives, or itchy skin, bouts of eczema, psoriasis, or acne, little red dots called hemangiomas in the skin, and then digestively, bloating after eating, and especially after eating fat. Hemorrhoids or an itchy anus are a common sign, and sensitivities to basically anything, but especially perfumes and chemicals. You can't be around people that are wearing things like cologne. Headaches and migraines, especially the kind that sit in the front of your head or in your TMJ area. Bruising, high cholesterol, high triglycerides, high blood pressure are all signs of liver stress. Varicose veins, urine that's darker and more smelly, a tongue that's coated white when you stick your tongue out, or a deep split down the center of your tongue. And then overheating, especially like hot feet and hot flashes at night, are super common signs for especially postmenopausal women who have poor liver function. And then feet that have like the soles that are peeling and really hard. And then finally, anyone who's basically overdoing alcohol of any kind. Yet most of us don't know how to check for liver dysfunction. The only check that most doctors do is liver enzymes, AST and ALT. But the fact is, these liver enzymes don't go up until much of our liver is already compromised. And so home tests, simple, free tests that you can do on yourself right now to find out if you have liver dysfunction. Murphy's sign is a great test for liver and gallbladder issues. When organs are under stress, they always get bigger, they swell, they become inflamed, and they become tender to touch. And so simply by pushing underneath the right rib cage and assessing for tenderness, you can tell if your liver and gallbladder are under stress. Here's the best way of doing it. Have someone do it on you. And that person will get their fingers right underneath the right rib cage. They'll apply pressure, about 5 pounds of pressure, up underneath the rib cage. And then the patient breathes in, the patient breathes out, and you put a little bit more, and you increase about 10 pounds of pressure. If there's considered pain on any stage of this, normal, breathing in or breathing out, it's a sign of poor liver and gallbladder function. It's an easy test, and what I usually do is assess on a scale of 1 to 5. 5, the person's coming off the table, they're in acute pain. And then 4, 3, 2, 1 are all stages of pain and tenderness. I think anything more than a 3 is a sign of a liver and a gallbladder that need to be addressed. The right thumb web test. It's a simple palpation test to see if you have long-standing duress in your liver and gallbladder. The liver acupuncture meridian starts right through here. So what's called liver points 1 through 4 become tender when the organ is stressed. And so simply you just pinch with about 5 pounds of pressure between your thumb and your first finger. If that is painful, again, a scale of 1 to 5, if it's over about a 3, you're coming off the table, it really hurts, it's a sign that your liver and gallbladder are probably in need of nutrition. So if you're struggling with poor liver function, if the symptoms are positive, your thumb, the pressure, the belching, if you're noticing you're getting that hard pot belly, a change is needed. You need to give nutrition for the liver. Certain nutrients are required for your liver to be able to keep up and then drain. Our product that we formulated called Liver Gallbladder Drainage is all the nutrition that your liver needs to go through the different phases of detoxification and then finally drain. Our program, the DNA Reset, helps address lifestyle changes that are necessary to try to get your liver working better. And so I encourage you, if you're having liver problems, make a change. Make the lifestyle change and try to add in nutrition that's going to help your liver function.